Hello. This is Dr. Amir, your online health physician. Today we will discuss a disease called depression. This 10 to 15 minute video will likely solve any questions you may have about depression. But before that, kindly subscribe to my channel and share. Also hit the bell icon for upcoming health videos. Doctor, what is depression? It is a mental illness that causes persistent sadness, lack of energy, feelings of guilt or worthlessness, difficulty concentrating, changes in appetite, sleep patterns, and thoughts of self-harm. It can severely impact daily functioning and requires proper diagnosis and treatment for recovery. Doctor, what is the medical reason for depression? The exact medical cause of depression is not fully understood, but it is believed to involve a combination of genetic, biochemical, environmental, and psychological factors. Imbalances in brain chemicals, neurotransmitters, such as serotonin and norepinephrine, are thought to play a role in the development of depression. Doctor, how does one come to know if anyone's suffering from depression and what are the symptoms? Recognizing depression in oneself can be challenging, as symptoms can vary from person to person. However, if you experience several of the following symptoms persistently for at least 2 weeks, it may be an indication of depression. 1. Persistent feelings of sadness, emptiness, or hopelessness. 2. Loss of interest or pleasure in activities you once enjoyed. 3. Changes in appetite or weight, significant weight loss or gain. 4. Sleep disturbances, insomnia or excessive sleep. 5. Fatigue or loss of energy. 6. Feelings of guilt, worthlessness, or excessive self-blame. 7. Difficulty concentrating, making decisions, or experiencing memory problems. 8. Restlessness or slowed movements in speech. 9. Irritability or excessive crying. 10. Physical symptoms such as headaches, digestive problems, or unexplained aches and pains. 11. Recurring thoughts of death, suicide, or self-harm. It's important to note that everyone's experience with depression is unique, and not all individuals will exhibit all of these symptoms. If you suspect you may be experiencing depression, it is advisable to seek a professional evaluation from a mental health provider who can assess your symptoms and provide appropriate guidance. Doctor, why does depression happen in individuals? Depression can occur due to a variety of factors. It can be triggered by significant life events such as loss, trauma, or major changes. Biological factors, including genetic predisposition, chemical imbalances in the brain, and hormonal changes, may contribute. Additionally, environmental factors, chronic stress, and certain personality traits can increase the risk of developing depression. Doctor, is depression happen if you feel alone? Feeling alone can be a contributing factor to the development or exacerbation of depression. Social isolation and lack of social support can impact mental health negatively. It leads to feelings of sadness, hopelessness, and loneliness, which may contribute to the onset or worsening of depression. Doctor, does depression happen during the study? Yes, Depression can occur during studying or academic periods. The pressure to perform well, high expectations, academic stress, and other factors related to studying can contribute to the development or exacerbation of depression. It is important for students to prioritize their mental health and seek support if needed. Doctor, does depression happen in friends or social circles? Depression can affect individuals regardless of their social context, including friendships. While having friends and a support system can be beneficial for mental health, depression can still occur. It is possible for individuals to experience depression while having friends or even within a group of friends. Depression is a complex condition influenced by various factors, and social relationships alone may not prevent or cure it. Doctor, does depression affect husband and wife relations? Yes, depression can significantly impact husband and wife relationships. The symptoms of depression, such as persistent sadness, loss of interest, irritability, and decreased energy, can strain the emotional connection and communication between partners. It may lead to feelings of isolation, reduced intimacy, increased conflict, and a sense of detachment within the relationship. Supporting and seeking professional help can be crucial for both individuals to navigate and overcome the challenges posed by depression in a marital relationship. Doctor, does depression affect children? Yes, depression can affect children as well. In children compared to adults, it can still lead to persistent feelings of sadness, irritability, loss of interest in activities, changes in appetite and sleep patterns, difficulties in concentration. Depression can impact a child's overall well-being, academic performance, social interactions, and relationships with family and peers. Early recognition, appropriate support, and professional intervention are important for addressing depression in children. Doctor, what ages of children are most affected by depression? Depression can affect children of various ages, but certain age groups may be more vulnerable. Adolescents, typically between the ages of 12 and 18, are often at a higher risk of experiencing depression due to hormonal changes, academic pressures, social challenges, and identity development. However, depression can also impact children at younger ages, including pre-adolescents and even younger children, though it may be less common. Each child's experience is unique, and early intervention is essential regardless of age. Doctor, does depression affect my efficiency? Yes, depression can significantly impact your efficiency and overall functioning. The symptoms of depression, such as low energy, lack of motivation, difficulty concentrating, and decreased interest in activities, can make it challenging to perform tasks effectively. Depression can affect your ability to focus, make decisions, meet deadlines, and maintain productivity. It is important to seek appropriate support and treatment to address depression and improve your efficiency and overall well-being. Doctor, Is there any types of depression? Yes, there are different types of depression. Some common types include: major depressive disorder is characterized by persistent feelings of sadness, loss of interest or pleasure, changes in appetite or weight, sleep disturbances, low energy, difficulty concentrating, and sometimes thoughts of death or suicide. Persistent depressive disorder, also known as dysthymia, involves a chronic state of depression lasting for at least 2 years, with milder symptoms. Postpartum depression occurs in women after giving birth, characterized by feelings of extreme sadness, fatigue, anxiety, and difficulty bonding with the newborn. Seasonal affective disorder, a type of depression that occurs seasonally, typically during the winter months when there is less sunlight. Bipolar disorder involves alternating episodes of depression and mania, with periods of elevated mood, increased energy, and impulsive behavior. Psychotic depression combines depressive symptoms with psychotic features such as hallucinations or delusions. These are just a few examples, and each type of depression can vary in severity and duration. It is important to consult a healthcare professional for an accurate diagnosis and appropriate treatment. Doctor, how does one come to know if suffering from depression? Recognizing depression in oneself can be challenging, as symptoms can vary from person to person. However, if you experience several of the following symptoms persistently for at least 2 weeks, it may be an indication of depression. Persistent feelings of sadness, emptiness, or hopelessness. Loss of interest or pleasure in activities you once enjoyed. Changes in appetite or weight, significant weight loss or gain. Sleep disturbances like insomnia or excessive sleep. Fatigue or loss of energy. Feelings of guilt, worthlessness, or excessive self-blame. Difficulty concentrating, making decisions, or experiencing memory problems. Restlessness or slowed movements in speech. Irritability or excessive crying. Physical symptoms such as headaches, digestive problems, or unexplained aches and pain. Recurring thoughts of death, suicide, or self-harm. It's important to note that everyone's experience with depression is unique, and not all individuals will exhibit all of these symptoms. If you suspect you may be experiencing depression, it is advisable to seek a professional evaluation from a mental health provider who can assess your symptoms and provide appropriate guidance. Doctor, how to diagnose depression? Diagnosing depression typically involves a comprehensive assessment by a qualified healthcare professional, such as a psychiatrist or psychologist. Here are some common steps in the diagnostic process. Initial evaluation. The healthcare professional will conduct a thorough interview to gather information about your symptoms, medical history, family history, and any potential triggers or stressors. Diagnostic criteria. The healthcare professional will assess your symptoms based on the criteria outlined in the Diagnostic and Statistical Manual of Mental Disorders. This manual provides specific criteria for diagnosing mental health conditions, including depression. Physical examination. A physical examination may be conducted to rule out any underlying medical conditions that could be contributing to your symptoms. The healthcare professional may use standardized questionnaires or screening tools designed to assess depression and its severity. These tools can provide additional insights and aid in the diagnostic process. The duration and impact of your symptoms will be considered to determine if they meet the criteria for a depressive disorder and to assess the severity of the condition. The healthcare professional will consider other possible causes for your symptoms and rule out conditions that may mimic depression, such as medical conditions or substance abuse. A collaborative discussion between you and the healthcare professional will take place to reach a shared understanding and agreeing on the diagnosis. It's important to remember that diagnosing depression is a complex process, and it's crucial to consult with a qualified healthcare professional for an accurate diagnosis and appropriate treatment. Doctor, is there a full cure for depression? Depression can be effectively treated, and many individuals experience significant improvement and remission of symptoms. While there is no guaranteed full cure for depression, it is highly treatable with the right approach. Treatment options may include a combination of psychotherapy, such as cognitive behavioral therapy. Also medication, such as antidepressants, lifestyle modifications, and support from a healthcare professional. It is important to remember that each person's experience with depression is unique, and the effectiveness of treatment can vary. Seeking professional help and following a personalized treatment plan can greatly increase the chances of recovery and managing symptoms effectively. Thank you, Dr. Amir. It was a really informative session. Wish to see you soon with other health topics.